There's symptoms that may sound familiar to many of us, but sometimes they're an indication that something much more serious is going on with your body. I'm talking about fatigue,
Oh, yeah.
brain fog, digestive problems. How about always feeling cold or having cold extremities?
Mhm.
Well, Dr. Joshua Red, who is a chiropractic physician, is here to talk to us about, well, it's something called functional medicine, I believe.
Mhm.
And it's a kind of more in depth way to attack these symptoms.
Absolutely. Dr. Joshua Red joining us now with Red River Health and Wellness, here to make us feel more well and have
How
better
are you
health.
guys?
How are you,
Gosh,
buddy? It's good to
I
see you
Great.
miss you
again.
guys.
How
I
are
want to give
you?
you like a virtual hug because it's been a while since I've seen you
Big COVID hug.
in
COVID
Let's
hug.
person.
take
Here it
it.
is.
COVID hugs.
So, I mean, a lot of the things she's mentioning, it kind of points towards one thing, which is low thyroid. And you're hearing this more and more when it comes to, you might just be a Google search or you just hear it through the grapevine. Well, thyroid, what does a thyroid even do? Explain what low thyroid is.
Yeah. Yeah. Almost 10% of individuals have low thyroid. And it's actually where your thyroid isn't producing the proper thyroid hormones. This causes a ton of problems metabolically and it creates so many different symptoms. And then to make matters worse, oftentimes nobody understands the mechanism of why you have low thyroid, meaning that they're on thyroid hormones, but nobody knows why.
Hmm.
They know they have a low thyroid,
Mm.
but nobody's identifying what's the mechanism behind that, if that makes sense.
Gotcha.
Well, and you can come into Red River, and what I love is that you really want people to understand what is going on with their bodies. So, whether it be low thyroid, Dr. Red, or another autoimmune disease, you are able to get past just the symptoms and determine what is going on with people's body. How?
That- That's a key component. Our whole goal is to do all the proper medical testing that we can and blood work and identify exactly what is really causing these patients' chronic conditions. So, for example, if you have low thyroid, the number one cause of low thyroid is actually a bigger, more complicated disease called Hashimoto's disease. They say close to 70 to 80% of individuals with low thyroid actually have this bigger, more complicated disease. Um, which is so important because it changes the whole way that we should manage these patients. If you have an autoimmune disease like Hashimoto's, there's a lot of different triggers that will cause it to flare up. There'll be like something as simple as dietary and lifestyle triggers. There'll be environmental triggers. There'll be triggers within the body, certain imbalances that will exacerbate it and make it worse.
Wow.
And so, really, our whole goal is to go through and identify exactly what's causing these patients' triggers to flare up, and then our goal is to try to improve them one by one, and then really help educate and teach these individuals and show them what to do and what not to do. And you'd be shocked. Like there's simple strategies that we can do that are just so simple that just knowing what those imbalances are or knowing what your specific triggers are, it changes everything and it can change their outcome and how they feel for life to come, right?
Yeah, absolutely. Actually, my wife, she has Hashimoto's disease. She found that out through working with Red River Health and Wellness, and incredible to be able to finally know, okay, what is the source of all these problems? Because there are people that might take medication for the symptoms they have, but they still feel kind of icky still. Why?
Hmm.
For sure. And granted, like we'll have patients where they're kind of like are herded around like sheep, and you get a pill every 6 months, and that's kind of it.
Yeah.
Uh, our office for those that really want to get to the bottom of things and want to put forth effort, because it's a lot of hard work for us, but it's a lot of hard work for them too.
Mhm.
But the best part is that we don't have to just treat symptoms. We get to the mechanism really of why you feel bad. We understand what the mechanism is and all the different imbalances that go along with it, and then teach the patients along the way. And it just seems like it's a more optimal approach.
Mhm.
Sometimes the imbalance is literal, like the inability to balance. I believe we're going to see that here in a before and after video of your patient, Anne. Tell us Anne's story.
Yeah, so Anne had Hashimoto's and celiac disease. So she had Hashimoto's, low thyroid, and celiac disease. She felt horrible. She had severe insomnia. She had restlessness, fatigue, weight gain. She just didn't feel like herself. I mean, I think she was getting like an hour and a half of sleep. One of the biggest things, though, is when somebody has an autoimmune disease, and she was suffering with this for about 4 to 5 years, and nobody really knew what to do.
Yeah.
She came to me and she was at her wit's end and she just felt so awful. I remember her like physically shaking because she was just so exhausted because she just wasn't, her mind wasn't turning off. Most people don't realize though, if you have an autoimmune disease, they don't realize the impact that it has your brain. Our brain doesn't have like pain receptors, and so we don't feel pain. But what we'll feel if we end up having brain symptoms, we'll feel like depression and fatigue. Those are the most common
Mm.
ones. Or we'll have we'll do neurological tests and you'll see these individuals not be able to actually function. So you'll see my patient Anne, she literally isn't even able to do a simple neurological test. She's not even able to initiate it because
Wow.
her balance is so far off. And she had no clue prior to this. But you look at these patients and you see the impact that they have on their brain. That's a huge deal. Like, if we don't address this, these patients kind of just wither away and just keep getting worse and worse and worse as the brain's on fire, as the brain can't properly, communicate and function like it should.
Yeah. And how's Ann doing now?
Now, I mean, you look at Anne now, her quality of life is way better. I mean, she had like 0 good days a month. Now she has
Mm.
majority of good days a month. Her quality of life is markedly better. She's able to lose weight, but most importantly, she's able to function. Like, her brain is functioning a lot better. So here's the post videos of her actually doing the same neurological test 6 months later, and you can see how much better she's actually doing. Like, she's able to function a lot better. Her quality of life is significantly better. But
Yes.
one thing that most people don't realize is
Mhm.
she knows now what to do and what not to do. Like, she is in control of her health. Her health is no longer spiraling out of control. She's no longer panicked and feeling hopeless. She now knows how to keep things in check and how to keep things moving forward, which
You,
is really the
It's
best part
just
about what we do.
you
It's
taught her how to
awesome,
fish.
Dr.
Yeah.
Red. Thank you so much. We've run out of time, but you have a special offer of a consultation for anyone who comes in to see you, and not just any consultation, an in-depth one. So we're going to have that up on our screen. Thank you so much for
Awesome.
joining us. Again, the in-depth consultation, absolutely free. Just give them a call at 1-866-36-RIVER. You can also go to redriverhealthandwellness.com.